My comments today are a combination of the state of the field in San Antonio and in Texas. Before I show you those slides, I'd like to make just a couple of general comments. 1 in 6 jobs in San Antonio are dedicated to the biosciences, to healthcare and the biosciences. This is a $31 billion industry in San Antonio, by far the leading industry in San Antonio. The Health Science Center educates 3,200 health professionals in its 5 schools. We have 26,000 alums, and the chances are about 30 to 40%, maybe 45%, that if you see a doctor, a dentist, a nurse, a physical therapist, an occupational therapist, someone in the health sciences, that they will have either gone to school at the Health Science Center or they will have trained at the Health Science Center. In addition to the 3,200 students on the campus, there are 1,000 trainees, people in training, postdoctoral trainees, residents and fellows, learning their craft in our hospitals. So a large segment of the healthcare today and what will be provided in the future depends on the success of the missions that we carry forward here. My comments today are about what I see as present and what I see as potentially future for this sector. So the first thing to say, every one of the presidential candidates will make a point about the fact that we can't spend any more on healthcare than we're currently spending. And all of you as CEOs, presidents, and business people understand that healthcare consumes a significant part of our business dollar, of our economy. It's now 17% of the GDP, and it's estimated that unless this Affordable Care Act kicks in and works, and it's still, the jury's still out about that, the rise in the amount of spending, the percentage of spending, the GDP on healthcare will continue to rise. That's why the Affordable Care Act, in large part, was created. It was meant to bend the cost curve of healthcare going into the future. It, in my view, is unlikely to be repealed. Depending on your politics, you may have a different view of this, but just looking at the hurdles that have to be overcome to repeal the Affordable Care Act, my sense is that it will not be repealed. The lack of Medicaid expansion in Texas means that we lead the nation in the highest uninsured rate, 19%. Now, the reason to be concerned about that as business people is because there is a cost for not having more Medicaid expansion. First is that the health care that's delivered in emergency rooms is inefficient. There is no follow-up, there is no prevention, and the recidivists who go back to the emergency room get poorer care. So their health is poorer, their ability to work is poorer, their loss of days are greater, and the net result for our state is that we lose our workforce. The second reason is that it's more expensive because there are duplication of tests. If you're seen in the Baptist emergency room at Tuesday of last week, but then seen in the University Healthcare emergency room Wednesday of this week, there's no communication between these places because their electronic medical records do not talk to each other. As a result, depending on what your problem is, a whole series and battery of tests may be repeated, which are expensive and unnecessary because they were done last week in another place. So the fracturing, the fragmentation of healthcare contributes to the cost. Third, we're paying for this uninsured population in at least 2 ways. We all pay taxes in big cities to the county hospital district. We have to pay into that to support the uninsured and underinsured care that's delivered. That, to University Health System, which is our Bexar County hospital, is about $350 million a year. Now, the big cities in Texas bear the brunt of these costs. Dallas County, Tarrant County, Harris County, Travis County, and Bexar County. We pay these costs because the other counties in Texas send their uninsured and underinsured patients to Bexar County, to Dallas County, to Tarrant County, to Harris County. Hence, we who live in the city pay for more of this. There are 254 counties in Texas. There are 254 different healthcare systems in Texas. And the big cities bear the biggest cost of what this is. Second thing is our premiums go up because our insurers charge us more because their costs go up because of these uninsured costs. Texas hospitals provide about $6 billion in uncompensated care today, and that is spread out across the state, but it concentrates in these big cities. Now, as far as physician demand is concerned, this slide shows in the black bar the growth of physicians in the workforce, and it's going up, as you can see. The issue is that the population, shown in the red line, is growing at a faster clip. Hence, the delta between the number of physicians and the need is growing. The gap is growing wider. And the reason that this is important is it dictates a whole new system of care. We have to have nurse practitioners, we have to have physician's assistants, we have to have healthcare providers who are non-physicians providing a significant portion of the care going forward, because there's no way to close this gap. You can't open enough medical schools, you can't expand the classes rapidly enough to fill this need. So important to remember that. And on the right-hand side of the slide is shown the fact that it's estimated that the growth in the healthcare professions, if you're an investor in where economies are going to grow, the healthcare sector is certainly going to grow. This is because the population is growing, because the number of insured, at least in other states, is growing, and more people will come to attention. And the final thing is people of my age, baby boomers, are growing more rapidly than anybody else. And the number one risk for heart disease, cancer, diabetes, and dementia, all of these diseases are number one risk factor, and that's age. And as the population ages, there will be more pressure put on all of our healthcare instruments to take care of these people. So Keith told me this is a conservative growth estimate. The numbers I had said that Texas will grow by 3 to 4% in the next 5 years. The population of Texas will grow. San Antonio is expected to double that rate. So we are a target for more growth than the rest of Texas. And the punchline is 22% of the growth will be in people over the age of 65. Think about that. An incredible demographic shift occurring right here in San Antonio. So the healthcare workforce is going to have to increase. The largest insurers in Texas are Blue Cross, Humana, Aetna, and United. There's been some consolidation in that industry. If I could sum up what's going on in the healthcare insurance industry and in the marketplace that I deal with, it is that you have to produce more efficiencies and you have to document quality. That's what all of this is about. All of these affordable care organizations, all of these medical homes, all of that is to create efficiencies and economies of scale at the same time that the outcomes are better. You may have noticed that there is a lot of consolidation in the healthcare market in places like Dallas. The reason for that is that there are nonprofit hospitals which dominate the landscape in Dallas, and they have combined with other nonprofits to create these covered lives, large entities. That is less likely to happen in San Antonio, in my prediction, in the next few years, because the hospitals that have the largest market share in San Antonio are for-profit hospitals run by consortia outside of San Antonio. The Methodist Hospital is owned by HCA, which is run out of Nashville, Tennessee. The Baptist system is owned by Tenet, which is run out of Dallas, Texas. And even the non-for-profit Christus system is run out of Arlington, Texas. So as far as homegrown not-for-profits in San Antonio, the lack of these means that there's likely, at least in my view, to be less consolidation because HCA and Tenet are competitors in the national marketplace. And for them to join together would be a tectonic shift in healthcare. New approaches to delivery of care. I've already covered this. The basic bottom line of this is that emergency rooms are not ideal places to get health care. There's no continuity, immunizations, prevention, all of those things go by the board. It's very fragmented. So it's inefficient and expensive. Personalized medicine means this. What's coming, Pat asked me to make a comment. What's coming is, it may be, if you're 40 or 45 years old, you'll probably see this in your lifetime, where you'll go in and have a test, maybe even as something as modest as just a pinprick test, and the blood will be analyzed. And if you're about to be put on an antibiotic, for example, for an infection, they will do a profile of your genomic makeup and determine whether or not the antibiotic that you're getting will be metabolized in the way it is in most people, or whether you're part of a minority of people who metabolize it more rapidly, thereby requiring you to get more antibiotic than somebody else. In other words, the personalized, targeted, customized care that you'll be seeing in the future is probably a decade or 2 decades, maybe 3 decades away, but it's coming. And finally, the biggest news in this targeted care has occurred in cancer immunobiology. This is Nobel week for Nobel Prizes. My prediction didn't hold through. The people who won for the Nobel Prize in Physiology and Medicine this year won for developing an antibiotic that cures Chagas disease, which is not a public health problem in San Antonio today, but may become more of a problem with the influx of individuals from Latin America into Texas. I predict that next year or the year after, the Nobel Prize will be won by investigators who have developed this whole new field of immunotherapy for cancers. Immunotherapy means that you turn your own immune system on to kill the cancer. Rather than giving a globally toxic drug that makes you sick for weeks and weeks and weeks and months and months and months, makes your hair fall out, makes all of these things that are just horrible side effects happen. Rather than that, you get a drug which turns on your own immune system or removes the checks on your own immune system so it can kill the cancer. There's a theory in biology that we kill cancer every single day. And one of the reasons that aging is associated with more cancer is our immune systems, as we age, become fatigued. And as they become fatigued, they don't do as efficient a job in eradicating these cancers. The slide on the top part of this panel, which is barely visible here, is a slide from a young woman with ovarian cancer metastatic to her lungs and her liver and other lymph nodes. So let me orient you. This is the top of the person, this is the bottom, this is her feet down here, this is her left side, and this is her right side. This is her liver, this is her spleen, that's her heart. These black dots represent metastatic tumor in her lungs. They also represent metastatic tumor in her gallbladder area, in her periaortic lymph nodes, and in her inguinal lymph nodes. She has widely spread stage 4 ovarian cancer. She received immunotherapy, a therapy developed by one of our investigators at the Health Science Center for this very hard to treat, very difficult to cure cancer. And a few months later, this is her scan from that study. What it shows is the cancers in her lung are gone, the cancers in her inguinal lymph nodes are gone, the periaortic nodes are gone. The dark shading here is her bladder, which is a normal finding and doesn't indicate cancer. So while there is some residual tumor in this young woman, it is far greater than any result would be achieved with globally toxic therapy. And her prognosis, while still guarded, increases her lifespan substantially. Now, this is a dramatic example of what's going on in the healthcare field. I think the person who's going to win the Nobel Prize has focused on treating a horrible disease, metastatic melanoma, and has had, it's hard to say this and have it be true, but 40% survivals of stage 4 melanoma patients. Everybody I treated as a young person, as a young physician, died in weeks with that diagnosis. So tectonic shifts, truly dramatic shifts in this targeted immunotherapy. So last thing to say, I'll end up with this. The aging population has another collateral effect which is devastating, and that is the specter of dementia, Alzheimer's disease. 1 in 9 of us over the age of 65 will develop it. When it attacks one person, it actually attacks a family. There are whole groups of people who go down with this. It is devastating for the economy. Last week I had the privilege of announcing the fact that we're establishing a new Alzheimer's center, which will be a comprehensive center to take care of patients, enroll them in clinical trials, take care of caregivers at the Health Science Center. We hope to stand this up in 2016. It's an example of skating to where the puck's going to be, trying to meet the healthcare needs of our community going into the next 5 to 10 years. Thank you for your attention. I appreciated being here.